Hi, Lee Thurburn here, and I want to welcome you back to another episode of Live Stream Lee, where we talk about entrepreneurship and small businesses and success and all that kind of good stuff to try to help our small business listeners and entrepreneurs figure out how to become more successful faster. That's our whole purpose in life here. We meet every day, Monday through Friday at 3 o'clock. We spend 30 minutes talking about something. Monday through Thursday, we actually have a show that is the first half I talk about a subject of some sort, and then in the second half we have an expert come in and chat with me about that subject so that you get another little additional perspective. But on Fridays we have interviews, and today we're going to be interviewing a good friend of mine and a successful entrepreneur that's in the telemedicine business. Before we jump into that interview, I want to make sure that you know that you can go to livestreamlee.com and get all the information about our show as well as join our community. If you go to livestreamlee.com and click on the Join My Community link, you create an account with Apricot Rocket, which is the software company that I own. And as a result of that link, you'll get a CRM and a marketing automation tool, email, text message marketing, excuse me, and a whole bunch of other great stuff, that digital marketing tools that'll help you grow your business. All right. So our guest today is a guy named Randall Mills. Randall Mills is the CEO of a telemedicine company called 24HourPhysicians. And Randall's going to tell you all about his business, but bottom line is, if you need to talk to a doctor today, you need to know about 24hourphysicians.com. So without further ado, I'm going to turn that little placard off and I'm going to invite Randall in. Hey, Randall, how are you doing today, sir?
Hello, Lee. I'm doing fantastic.
I'm glad to have you here today. Randall, let's start off with you telling everybody a little bit about exactly what your company does. It's a little bit more than just talk to a doctor today, but why don't you tell us about it?
Yeah, absolutely. I appreciate the opportunity, Lee. I'm in general an IT technologist, and so I love developing technology applications for certain industries. I've had the opportunity to do that in the oil and gas industry for 10 years, and then I did it in financial services for 10 years and retired from a company called Citigroup. And I had the opportunity to start in healthcare as my third job, in more of an entrepreneurial type role in developing call centers using technology. And then we added a doctor network on top of a nurse-based call center to create telemedicine. So in general, I guess you could say I'm a pioneer in the telemedicine and telehealth, and which we now call healthcare industry.
Well, so how many years ago, how far back in time did you actually start 24-hour physicians?
Yeah, 24-hour physicians was actually trademarked and branded about a little over 5 years ago. And so I've been doing telemedicine since 2005 with other organizations, and through the gaining that experience and gaining those relationships, I was able to start my own company and my own brand 5 years ago under the corporate name Healthcare Now and the brand name 24-Hour Physicians.
So, Randall, you're in an industry with some really huge players. I don't probably know them all, but you've got like MD.com. Aren't they in the same industry, MD.com?
MD Live is one of our competitors, and Teladoc is a public company. They went public a few years ago, and which really brings the integrity and the level of investing in our space. Teladoc has really been the pioneer to tackle compliance issues with state medical boards, and to really, they're a trailblazer. And so as a smaller company, we follow these larger companies' leads. And they've done a great job creating an environment where we all can work in and build and our doctors can get more, and patients can get more access to doctors.
It sounds a little bit like a David and Goliath story here, where you are the David and they're the Goliath. So whenever you have that kind of a situation, obviously competition and how you distinguish yourself has got to be a little bit of a challenge and a focus of yours. How do you differentiate your product and service with the big guys out there?
Well, it's a lot like the beverage industry, I guess. You have the big players like Coca-Cola and Pepsi, right? But, people get tired of drinking Coca-Cola and Pepsi, and they want something more customized, to their flavor. And so they go for Snapple, or they like, different flavored teas, or they might like different flavored waters. And so in healthcare, there's a lot of opportunity there to customize a solution and service at the local level and at the regional level and the national level and the worldwide level. So as an organization, you really have to identify what market you want to develop your product after, and then identify what niche you want to go after to serve your customer base.
So are you a nationwide company? Or are you limited to just the Dallas or the Texas markets? Describe what your reach is, how many doctors, how many states you're in?
Yeah, absolutely. That's a great question. We are a nationwide company. We have doctors that are licensed in all 50 states and Washington, D.C. and Puerto Rico. And so through our network of doctors, you can go to 24HourPhysicians.com and say that you have a need to talk to a doctor. And the system, through business intelligence and analytics, will schedule you a doctor that is licensed in the state that you currently are located. Now, that's important because when our doctor calls in a prescription to the pharmacy, we want to make sure it's in the state, the pharmacies in the state and the doctors in the state that you are currently located, so that the pharmacy won't question about the doctor's ability to write you a prescription.
Well, let me ask you a follow up on that whole prescription thing, because, I've heard an awful lot about, opioid addiction and abuse and pharmacies and all that kind of stuff. So are there limits on what kinds of prescriptions that your doctors can write, or is it pretty much across the board?
Yes, there are limits in telemedicine. We are not able to write any federally controlled substances that are controlled by the DEA, and we're not able to write any state-controlled substances that's controlled at the state level. So we have algorithms that when someone asks for a prescription, and we have algorithms that tell us that, in that certain state that prescription is not available, and we have to tell the person that's asking that for that request that prescription is not available in that state through telemedicine. We refer them to a brick and mortar type doctor to satisfy their needs.
So what are some of the common maladies that people will have that they get the benefit of you being able to use your service? Obviously, if I have a broken bone, I need to go see somebody physically. So what is kind of a general list of the common types of issues that people will use a telemedicine company for?
Yeah, absolutely. We're a lot like a family practice primary care doctor's office, where you go and you have a cold or a sinus infection, you have a viral infection. We can even evaluate a person's diabetic health and wellness, chronic care issues that we can evaluate and track those issues. We are starting to get into remote patient monitoring and incorporating monitoring devices, EKG monitoring devices, diabetic monitoring devices, to be able to help patients better and doctors better monitor and manage a patient's healthcare. So we don't do brain surgery and we don't repair broken bones, but we certainly can evaluate people and point them in the right direction to get those kind of services.
So if I were to call and get a doctor, and then a month or two later, I call back, will I get the same doctor each time, or is it going to be a different doctor? I mean, how does that work?
Well, we're like Burger King. We're a company of choices, and we allow our patients to make those choices. So when you call and talk to a doctor, it creates a customized member profile. And so that you can log in with your cell phone number, and you go in through a secure HIPAA compliant portal, and it tells you your patient history and the doctor that you previously spoke with. And you have the choice to talk to that doctor again, or you can schedule a different doctor if you have a different type of need that you would like another doctor to talk to you about. So it's really up to you.
Okay, so what about like transportability of your medical files and that sort of thing? Is it pretty much the same if I were to use 24-hour physicians doctor, say for 2 or 3 months or 6 months or a year, and then I were to get a relationship with a bricks and mortar primary physician? Will they be able to like just call up a doctor in your system just like they could any other doctor and get the records transferred over?
Absolutely. And we make patient medical records and electronic medical records. We make our goal is to make our system very user friendly for both the patient and for the patient's network of doctors. And so for the patient, they can simply download their patient records into a PDF file, because every consultation they have, there's a record created in a PDF file. So this is simply as going into your patient profile and downloading those either to your telephone or to your desktop. And you can email those to any doctor to provide supporting information so that doctor can better evaluate you as a patient as a whole.
So are there any other services rather than just doctor visits? Like, again, if I have the flu or something like that, I gather I can just call a doctor and then they can ask me questions and I can get a prescription. But beyond medical, are there any other types of services that you offer?
Yeah, absolutely. We also have a partner that handles mental health consulting and also handles drug rehab and addiction type consulting. And so if you were to call in and we were to talk to you and evaluate you about your health condition, and you were to advise us that you also have a mental health type need, we would schedule you with a mental health counselor or a psychiatrist, whichever would work for the instance is more important for you. And if we also have the services of we have a teledentistry service. So if you had a toothache and you wanted to talk to a dentist at night or over the weekend, we can schedule you with a teledentist or a telehygienist. And they have some amazing technology that you can even buy a camera that sets in your mouth, and they can review your mouth to see if you have an abscessed tooth and if you need to go to the doctor, or if we can ship you an antibiotic treatment and keep you out of that dentist office, which we all fear going to see the dentist.
Wow, I mean, that's really, to me, just amazing. It sounds like a really wonderful suite of services. So generally speaking, what does this kind of service cost? What would somebody expect to pay? How does that work?
Yeah, absolutely. We have you have the ability, when you come to 24hourphysicians.com, you have the ability to buy a one-time consultation if you just want to talk to the doctor just one time. And that costs around $99 if you want to talk to the doctor within the next 24 hours. But if you want to become a member and you join our member and subscribing to a monthly membership, you get a significant reduction to that cost of talking to a doctor, almost a 50% reduction. So you can join on an individual membership or on a family membership. And the individual membership is $13 a month, and the family membership is $22 a month for your entire family. And that qualifies for all those people and dependents that you report to the IRS. And so we love serving people on a membership level and giving them that huge, significant discount. And even for today on the Apricot Rocket program, today only, we're offering a special that you can try our membership for 30 days. And when you call in, just mention the name Apricot Rocket and we'll apply the discount to your order.
Well, that's very generous. Thank you. That's quite the deal. That means that somebody could just, if they need a doctor today, they could just call in. They could say Apricot Rocket, and then for what do you say? How much would it be for a same day? The doctor would call back shortly.
Yeah, for when you call in and say Apricot Rocket, you're going to get a 50% discount on your consultation order. So, and that's what our members also get. And so if your order is, if you choose to talk to a doctor within 24 hours, it's typically $99. So you get your consultation for $49, which is, almost 50%.
Wow, that's awesome.
Yeah.
Thank you for that. That's a huge deal. I appreciate you letting everybody know, and hopefully there'll be some people that'll take advantage of that, because that's a heck of an offer. Let's talk to me a little bit about what you can do for businesses. Obviously healthcare is a huge expense for businesses, and I'm wondering what kind of, if any, special programs that you have for businesses.
Yeah, absolutely. We do have a business to consumer market, which is our website, 24HourPhysicians.com, and then we have a business to business market. And so we have programs structured, towards certain industries like the restaurant industry, and we can package a healthcare program to a restaurant, a group of restaurant employees, or even a small restaurant that only has a few employees. And what we do is we give that restaurant owner, we give them the ability to sign up their employees at no cost to the restaurant, and the employees get the same significant discount that we're providing to our special members today. So we actually have various programs. We have all the marketing materials for the restaurant industry, for the rural America industry, for the farmers and small businesses that are out there across the United States and rural America that don't have access to a doctor like people in the city do. So we're customizing special marketing brochures to market to those businesses and to help those businesses open back up from this pandemic, because we know that cranking up this Model T and cranking up these businesses for our country is going to be very important, and keeping expenses low while you do that and providing your employees healthcare benefits is going to be very important. We're going to be frontline helping businesses do that.
So over the last 5 years, as you've been doing this, this sounds like quite a bit of an investment. I kind of understand software. You and I come from the same sort of background, and it sounds to me like a huge investment. Have you privately funded this yourself, or how'd you fund this? Is it investor money? Is it lender money? Is it your money? Is it a combination of those? I mean, what's that journey been like for you?
Yeah, that's an interesting question, and certainly very important for business owners is having the right capital to fund your business. And as an organization, we are a C corporation that is registered in Texas, and we do have the ability to bring on investors and stockholders, and we do that. I myself started out as funding the company and putting what we call gasoline in the tank to get the car running, and we were able to create technology through a partnership, with a local university, and create the software, the base software at a marginal cost. And then we were able to get a revenue stream and to be able to build up our revenue to be able to entertain discussions with investors. And so and when starting a business, you do have to invest your own capital at times, and you have to we call through going through an angel round and talking to friends and family. And I think it's very important that you become a storyteller, because and you could even go to the internet and input the word storyteller and learn how to tell a story, because you're going to be passionate about what you're trying to sell, and you got to tell that story over and over to investors and refine the story so that people will buy into what you're trying to accomplish.
So have you got all the funding you need, or are you still looking for funding? Where are you in terms of the sort of the growth of your company? Obviously, everybody that starts a business has targets and projections of where they want to be at a certain point in time in the future. How are you doing at meeting your goals and your hopes? And, are you currently looking for money? I mean, where are you at right now?
Yeah, absolutely. That's a great question. We have recently completed what we call a seed round, and then we're now going into a second round of that seed round. And so I have a board that I report to, and they're very familiar with fundraising. I'm basically an operations guy, and I maintain the technology, but they tell me we're going to go out and we're going to raise funds, and here's how we're going to do it. And certainly we have attorneys that advise us on how to structure those programs. And if you're talking to investors, it's very important that you're registered with the SEC and in all states that you're raising funds. But we are going through a second round of fundraising, and we use fundraising companies, to help put the word out that we're in the market and that we have a sustainable product and one that's very hot in the industry, and trying to attract investors and provide them the return that they're looking for their investment.
So Randall, would you like people, I mean, if somebody happens to be watching this and they'd like to talk to you about an investment opportunity, is this something that we can mention online? I mean, obviously we're already mentioning it because we're live, but would it be appropriate for them to just go to your website and give you a call? Or, I mean, how do you have a phone number you'd like me to put up that you'd like them to call? Is that okay for me to do?
Yeah, I would say that if there's someone listening that's interested in investing in 24HourPhysicians.com, that they go to our website and there's a comments section. You can submit a question or a concern or a comment, and just send us a comment that you're wanting more information about an investment opportunity in 24HourPhysicians.com, and we'd be happy to get that to our investment team and get you a copy of what they call a private placement memorandum. And we'd be happy to get you a copy of that so that you could review our business plan and review our private placement memorandum and evaluate that if it's something that you'd be interested in investing in.
So you're, again, basically in an industry with some Goliaths out there, and you're kind of the David. You're the small, currently I know you're not yet a Goliath, but there's a huge opportunity. What's been your biggest challenge that you've had to overcome so far?
Your biggest challenge is just keep focused on your goals and keep focused on your vision. Our vision is to be the company where doctors go to manage remote patient monitoring. And our vision is to gather better patient healthcare information than any company in healthcare. And that's a big, broad vision. But with the technology that's in place, we can gather patient information, through different remote monitoring devices, And that is our niche. And so there, are Goliaths that's focused on building their patient base, and that really are not focused on that type of niche. So we know what our focus is, and we focus very intently on accomplishing that. And it's like it's almost like taking a big chunk of marble and chiseling down and creating the statue, the Michelangelo statue that you want to present to the public.
Randall, we all learn lessons as we go through any project, and without a doubt, 2020 hindsight is the best hindsight you have, right? So knowing what you know now, what would you have done differently in the launch of this business? If you knew several years ago what you know now, what would you have done differently?
Well, I think it's very important that you evaluate people that you're partnering with, even investors. It can be very tempting to take on a partner that says, hey, I'm going to give you millions of dollars to help you grow your business, but you got to follow my plan. Okay. And literally overnight, you take that money and you become a puppet, and you are then working for somebody else's vision. So I think it's very important that you be very careful on who you take on as an investor or as a partner. Even as an executive in your company, you have to hire people that are going to be listening and are going to be buying into your vision. And that has been challenging. I have hired very successful and very knowledgeable and very driven type A executives. And I've had to, unfortunately, let them go because they didn't buy in to my vision.
Part of what you described is what I call the golden rule. He who has the gold makes the rules, right? So, unfortunately, when you take money from other people, whether it's a bank or an investor, you have to always be cognizant of what that influence is going to mean in terms of impacting your vision and how you execute on your vision. Because anytime you take somebody else's money, there's at least some degree of an obligation to listen to their input, and that can be a real challenge. So we have about 1 minute left. I just want to remind people that Randall made a great, incredible offer. If you go to 24HourPhysicians.com and you call their number, somebody there will answer the phone. They have a live person to answer the phone. And if you mention Apricot Rocket, they are going to give you a 30-day membership and allow you to which will allow you to get a same-day doctor's appointment for as little as $49. That's a heck of a deal. I mean, I can't even go to my doctor and get that kind of a deal. One last question. You have about 1 minute, maybe 30 seconds to answer this. Is your service, does it qualify for an HSA, health spending account expenditure? If somebody has an HSA and they want to purchase your service, is that a permittable expenditure?
It is a permittable expenditure. You can simply download what you paid for from your patient portal. You can simply download that to a PDF file, and you can email that to whoever manages your health savings account. First America manages my health savings account, and if you have health savings dollars, you can email that to them and pay through your health savings account.
Great. Randall, we're out of time. Thank you very much. I appreciate you being my guest today. Folks, Randall Mills, CEO of 24HourPhysicians.com. Randall, I'm going to cut out, and I'll see you soon, but thank you very much. Okay, folks, just as a quick reminder, if you go to livestreamlee.com and click on the Join My Community, you'll be able to join our community. And Randall and soon other vendors are, I'm sure, going to be offering special deals. And so as a member of the livestreamlee.com community, you have access to this great deal that Randall has just made. So we're going to go ahead and cut out now. We've hit the end of our show. Thank you very much. We'll see you on Monday at 3 o'clock. Thanks for joining livestreamlee.com. Bye.